Good afternoon, North Dakota. Thanks for joining us. Here we find ourselves not only in the middle of a regional COVID storm, but we find ourselves in the middle of increasing cases at a record level nationally, and we also find ourselves that globally in the Northern Hemisphere, cases are starting to take off. This is the what may appear to be the beginning of the fall surge, which has been predicted since the very beginning last spring when the COVID-19 appeared in the United States. And it has a historic precedence because if you go back to 1918, which everyone talks about the flu pandemic, the global flu pandemic at that point in time, as we'd shared earlier last spring, more people succumbed to the flu during that pandemic in the fall, in the October-November timeframe than they did in the spring. And these patterns can be for a number of reasons, but it appears that as we watched this pandemic spread across our country, well, it first arrived in the state of Washington, but then also being an international hub that it is, New York had a huge number of cases in the New York, New Jersey, Connecticut, Northeastern, and they battled that last spring. Well, we, taking quick action here in North Dakota, along with the rest of the country, had relatively few cases in our part of the world. It did move to the south. Florida, Alabama, Georgia, Mississippi, Texas, Arizona, and Southern California saw big surges in cases about the time we now know that people were moving from outdoors to indoors as temperatures soared in the south. In some of those summer states, approaching the 90 to 100 degree, the air conditioning came on, people went indoors, and then cases took off. We're seeing the exact opposite here across the northern tier of states, and whether that's from sort of Illinois to Idaho, Wisconsin, and across the upper Midwest and Eastern Rockies, a number of states that are recording records of all kinds right now compared to where we were last spring. If, in fact, this plays out, that the virus can be multiples, and some are suggesting that it could be an activity that could have been safely conducted outside, like a group or family eating outdoors in the summertime. Take that same group, put them in a confined space, indoors without masking, and you could have as much as 10 times the transmission because not only is there temperature, there's also humidity, and when you've got air conditioning, you've got low humidity, and here in North Dakota, when we heat our indoor spaces in the winter, we've got low humidity, and with the low humidity, the aerosol droplets can hang in the air longer. So we've got the perfect environment for spreading our indoor environments, the perfect environment for spreading the virus, and we know that it needs human hosts. It has to have humans to live in. It only can spread from human to human. So as we look ahead to what's in front of us, we've got some real challenges because we know that when people gather, that's when the virus can spread. We've known that all along. And when we think about Halloween this weekend, we think about deer hunting as a traditional time when people might gather in cabins and not just the outdoor part of deer hunting, but gathering in cabins and in groups and people that travel, or maybe they're gathering in bars or restaurants in small communities across our state around the weekends, the 3 weekends that cover deer hunting season, and that takes us right into Thanksgiving, followed by Christmas, and then also, of course, with the holidays, you end up with some student travel, perhaps coming back home again. So we've got a difficult operating environment for the next 2 months because the natural rhythm that we have in our state and the natural rhythm of holidays in our country, we've seen in other countries where there have been holidays have occurred, where surges have occurred after that, that this is going to be a really challenging time for us as a state and as a nation. And I think that North Dakotans and certainly Anyone that's been at this podium since last March has taken this extremely seriously. But I think now is a time for reflection for ourselves as a state, because we know that we have citizens that have from the beginning, along with us, taken this seriously. And there's others that maybe have said, hey, this is not so something to worry about. And while we want everyone to have the optimism and the confidence that we can get through it, we also need to have a seriousness around our resolve and our commitment. And we've talked a lot about individual responsibility, but today we also have to talk about community responsibility. And we've got some positive news to report, because we have seen communities coming together. We've seen local leaders that are providing leadership in those communities, and we're seeing some progress, because this virus is going to be, as we've said, it can't be fought on a global basis or an international or a national or even a state basis. It's going to come down to building by building, school by school, church by church, business by business, family by family, and interaction by interaction, down to the individual transmissible moments, the choices that people make as individuals or as groups to either gather or to be physically distant. And I want people to know I'm going to start trying to use the words physical distancing versus social distancing, because we want people to maintain social connection any way they can while they're maintaining a physical distance, because it's the physical distance that prevents the spread of the virus. So we've got a challenging time ahead of us, and as one of my friends says, let's get serious, folks, but we need to really get serious now to make sure that we can the actions we take now individually and collectively as businesses, as communities, as families will determine how we spent our winter. And when we think about things that we love, including whether it's gathering at the holidays or whether it's attending high school basketball games, whether those things are and how they're happening are going to depend a lot on what we do now, because when we increase our mitigation, which slows down the spread, it can take sometimes several weeks to see that. And with the rising numbers that we've had, it's important that we increase our mitigation now. And we've talked about a lot. There have been all kinds of debates about the role of government versus the role of individuals, but we know that these things work. We know that masks slow the spread. We know that physical distancing prevents the transmission. We know that large gatherings can be spreader events, and we know that everybody is free to choose where they go, how they spend their time, what businesses they go to, whether they attend an event or whether they don't. Government is not in a position to be able to determine that. And so again, as we as citizens of the state need to decide what our future is, and the choices that you make every day in terms of either creating more transmissible moments or not is going to help determine where we come out of this. And so we've said before, and ultimately, again, it's up to decisions, but people have to have their own motivation. Sometimes we've talked about this as finding your why you would need to come together and make decisions at the individual community level to mitigate spread, and whether that, and it seems to me that there are plenty of reasons. We know that there are, with 120,000 school kids, we know that from those school kids, we know that there's hundreds of thousands of parents and grandparents that want those kids in school. And so are we willing to risk the education of our students by ignoring a mitigation that we know works and that is literally free, physical distancing free, doesn't require an act of Congress, doesn't require trillions of dollars of economic aid, requires nothing, just requires daily choices by us, and not forever, just for enough time to slow the spread. Masking is virtually free. Also, we know that works, slows the spread. So are we willing to risk the education of our students? Are we willing to risk the lives of the elderly and those with underlying conditions? Because the tragic increase in deaths that we've seen in the last, since late September and October, is related to community spread. It's related to this virus in the community getting into the workforce, and that workforce bringing it in to those facilities. And so again, when we control the spread in the communities by our own actions as communities or businesses or individuals or families, when we control the spread there, we actually are doing things that can save lives of those in your very own community. You may not be related to them, you may not know them, but you're helping to protect the healthcare workers that serve them and therefore saving lives. We've had a lot of discussion about healthcare capacity, and we're fortunate in North Dakota that we've got a strong healthcare system, and we're fortunate that the vast majority of those healthcare staff beds have been able to be used throughout this pandemic for non-COVID related illnesses and procedures. But if we want to make sure that we've got enough for both non-COVID, which for most of this pandemic has been over 90% of the utilization, if we want to have enough for that and enough for COVID, then we also have to not only think about building hospital capacity, because everyone's like, how do we get more beds? How do we get more beds? How about we as a state decide we don't need as many beds, and the way we don't need as many beds is that we do the low-cost, highly effective mitigation efforts of masking and physical distancing. And also, when we're talking about protecting our elderly, we also want to protect our healthcare capacity. One way to protect that is by reducing community spread. We reduce the number of exposures for people that work in our hospitals and clinics because we know that workforce, we can buy more hospital beds, but there's a shortage of staffing. And you might say, hey, well, you can solve the staffing, let's just get traveling nurses. When we take a look at the next months heading into winter in the U.S., it doesn't even have to be a complete national breakout. If it's just the large regional breakout that we're talking about from the Great Lakes to the Rockies that we're in the middle of right now, within that, we're competing with Chicago, with Milwaukee. I mean, these are cities that by themselves have population multiples larger than our entire state. We're competing with them for workforce, for travelers, for traveling nurses. And so we have to, as North Dakotans, say, hey, there may be no cavalry coming in terms of additional healthcare workforce to North Dakota, because they're going to get consumed by the marketplace and other places. So we have to make sure that if we want to make sure that we have enough healthcare capacity, the way to do that is by us taking actions to keep ourselves and our families healthy, because we do not have an unlimited ability to expand and grow the number of staff to support beds in our state. So again, that would be another why to participate in the simple, low-cost, free mitigation approaches that are available to you every day, because you're not only trying to save the elderly and most vulnerable, but you're trying to protect our healthcare workforce, which ultimately could be taking care of you or a family member. So there's a lot of reasons to say why, and of course the other reason to say why is maybe for your own health. I know there have been a lot of folks that are saying, well, hey, this thing's no different than the flu, or it's like getting a cold, or I didn't have symptoms. The reason why they call it a novel coronavirus, is novel meaning new, is because there are no long-term studies. There isn't a study of saying, you know, here are the millions of college kids that got coronavirus 10 years ago, and these are all the long-term healthcare issues that they may be having. We just don't know that. Those are all unknowns, and when there are unknowns, it's sometimes good to respect the unknowns. And so again, if you have a choice between getting it or not getting it, it might be a choice right now to not get it. And we also say, well, how long are we doing this for? I'm confident that in Q1 of 2021, the beginning of effective vaccines are going to be available. And again, if those vaccines in particular can work well in people over age 70, those could become truly life-saving miracle drugs that help us protect those populations. And that's going to also take a lot of pressure off our healthcare capacity, and will take pressure off some of the needs for mitigation. But for right now, during this time frame of holidays and cold weather and indoor gatherings and low humidity and no vaccine on the immediate horizon, this is a good time for everybody to pause, to reflect, get serious, find your own why, and then make a decision that you can be part of being part of North Dakota that allows us to move through this. We were pleased this last week to welcome Dr. Birx back to North Dakota. We had some very collaborative meetings with both tribal and state and local leaders, all learning from one another. We certainly had a good conversation about the strength of North Dakota's nation-leading testing capability as the foundation of our COVID-19 strategy. And one of the things that we talked about and that came from those meetings is a renewed focus of making sure that we're strategically testing and identifying asymptomatic positives as a way to help slow and stop community spread. Asymptomatic meaning people without symptoms. Often they can be in that 18 to 39 age group. These are the folks that might, hey, I had a headache for a day, I had the sniffles for a day, I just kept on doing whatever I'm doing, going to school, going to work, going to gatherings, wherever those might be, whether it's athletic events or bars or church. But in the process of doing that, these individuals could have been spreading and spreading rapidly. We know that asymptomatic positives are one of the sources of spread. And so as we if we can identify asymptomatic positives, people that have no symptoms, and then get them out of circulation, so to speak, get them into isolation. We have with this level of community spread, there are likely thousands of unidentified asymptomatic positives that are out there, and if we can identify them and get them to not be spreading, that again is going to be part of a strategy which will reduce pressure on our healthcare system and on all of our other institutions. So as we move forward, again, we want to express our gratitude to the local leaders across the state who are encouraging and incenting communities to work together to slow the spread. There's a number of great examples of that. The Bismarck City Commission approved a pandemic mitigation strategy this week. Mayor Brandon Buczynski, the Grand Forks City Council, approved a measure regarding masks in Grand Forks. The Mayor Dick Johnson, Devils Lake Commission, did the same in their community. Jamestown Mayor Dwayne Heinrich enacted an executive order related to face coverings that's going to be voted on this week. And with just those measures alone, Bismarck, Devils Lake, Fargo, Grand Forks, Jamestown, Minot, Valley City, West Fargo, and all 5 of our tribal nations with whom we share geography have already previously had in place either strategies or mitigation or mandates related to mask. We now have over half the state's population and nearly all of our metro areas with some kind of mask measures in place. And the 2 metro areas that don't have them as yet, Dickinson and Williston, their local leaders working with COVID Coordinating Task Force started over a month ago in the case of Mayor Klug up in Williston to take actions to reduce gatherings. Both Stark and William counties have seen their active cases decrease in the past few weeks. And we know that from the call we had with all the mayors today, our weekly mayor's call with the mayors and county commissioners that represent about 78% of the state's population, we know that there are progress being made. And again, Dickinson is pulling out some things, again, local regulations that matter, taking a look at liquor laws and licensing. They're reinstituting curbside capability for people to order food and alcohol beverages, to be able to, in unopened containers, to be able to pick those up at curbside. And again, I want to thank Mayor Decker and Mayor Klug for their work. They're demonstrating that we know that masks work, but even without a formal mandate, they're reporting increases in mask wearing and, again, local regulations that can help people reduce transmissible moments. The First District Health Unit's CEO was quoted yesterday saying that with the Minot's mask measures, there already appears to be having an impact as more people choose to find their why and be part of the group that is helping slow the spread of coronavirus. And we know these impacts, that these changes aren't seen overnight. As I said earlier, typically it can be anywhere from a 2 to 4 week lag after mitigation efforts go in place. but looking at what we're seeing in Williams County and Stark County, those are examples where the feedback loop can be relatively short relative to our lifetimes, getting feedback in 2 to 4 weeks from actions that we take collectively. We fully support these local actions. We'll continue to support cities and counties, whether it's been with the enormous financial support through CARES Act funding, through testing resources, and by working with them on the North Dakota Smart Restart guidelines. But again, this is a battle just like a flood fight that needs to be fought locally. One of the great things about the conversations with the mayors is they, rather than talking generically about a category of businesses, say like bars, you can actually have a specific discussion with the mayors. They might know which local establishments in their communities are doing a great job with mitigation and protecting their staff and their clients, and they may know ones that they may need to swing by and have a visit and say, hey, we need you to be part of the team to help slow the spread and get on board with the guidelines. They've got that local knowledge about events and establishments that are happening, and so again, this is a community issue. Dr. Brooks said this herself when she talked about it coming into schools and nursing homes. She said it's up to the community now to follow these mitigations so we can stop the spread and further protect individuals that we know are the most vulnerable. And when she was asked about our vulnerable population plan, which has been shared as a model with other states, she said, well, because of the widespread community spread, that requires all of us and all of you. The governor nor any individual, not a mayor, no one can stop individuals from gathering together and having friends and family over for dinner. Only individuals can do that. And so again, appreciated her reinforcing our messaging about, in the end of the day, this comes down to the choices that individuals make to reduce transmissible moments. But again, I believe in North Dakotans, and I believe that North Dakotans are up to this challenge. We've met every other challenge we've had in our state's history, and even with the challenges of Thanksgiving and Halloween and Christmas and deer hunting and other things coming up, we know that there are people that have been and will continue to choose to physically distance and yet stay socially connected. But we also know that there are people that have been wearing masks. We know that more people are joining them every day across the cities and businesses. Especially want to thank the chamber here in Bismarck-Mandan that was supporting that, because again, when we see businesses that are putting in mask efforts for their team members and their customers, they are also playing a part in helping to protect the financial health of those businesses. And when they do that, they're protecting the economic health of the community, because all of those businesses, if we can help keep them open, they're paying the sales tax that helps pay a lot of things that we hold dear in community, even supporting everything from infrastructure to all kinds of basic government services. Let's take a look at the numbers that we're watching right now. With 6,771 active confirmed cases, this is another reason why we're saying again, this is a record. We need to be taking this pandemic in North Dakota more seriously than ever. And again, when we think about having 760,000 people in our state, we're getting close to that number. If we were at 7,600, that would mean 1% of North Dakotans are active right now. One of the things I want to give a shout out, if you're one of those 6,771 active cases, you have been asked to isolate, put yourself in a position where, well, you're a known positive, you're not spreading it with these higher positivity rates that we're having. If you're someone who's, again, we're doing, sometimes as many as 5, 6, 7, 8,000 tests per day. Most of those are going to the lab and back. We're working to try to get those answers back to people in 24 to 48 hours. If we're doing 8,000 tests a day at a 10% positivity rate, that means there's there's per day about 800 people that are likely positive at a 10% rate that are waiting for your results. So if you're waiting for your results and there's a 1 in 10 chance you're positive, that would also be a very good time. You've been asked to isolate until you get your results back. But if you isolate for 24 or 48 hours and then you get your news that you're negative, great, head back out again and physically distance when you do. But if you're someone who is, thinks that you may have been symptomatic, think you may have been positive, you can help do your part by starting your isolation immediately before you get your results back, because you would be, along with these 6,700 people, someone that would be most likely to be able to be identified, known spreaders of the disease. So again, we want to thank everybody who's an active positive in the state for following your isolation guidelines during that time frame. And again, if you've got a household member or a close contact to someone who's positive, if you're also following those guidelines, you also can be someone who can help slow the spread. So again, everybody's got something to do to help out, but actives and close contacts of actives, you've got even a more special responsibility to be part of us bending the curve right now. This 12% positivity rate over the last 7 days, that's a 7-day rate. That's the highest we've had at any time in the pandemic. Our current hospitalization at 184 is also at the top. We talked about this earlier, that we want to make sure that we're doing things to preserve capacity because of the potential, pending strain or shortage nationwide of hospital staff that would come with this fall-winter surge. And again, I guess we're off a little bit from the peak here because 192 a few days ago, but 184 near the top in terms of patients that are hospitalized due to COVID. When we take a look at the 14-day rolling average, it's the 14-day, it lags a little bit because just the nature of having 14 days worth of data in there, but it's climbed over 10%. It did climb over 10% for the first time back on October 22nd. Today it's at 11.5%. That's the highest we've been on our rolling 14-day average. When we take a look at the active COVID cases around the state, we have, again, with the increase we've had, some areas have been rising rapidly. On this slide, the darker the county, the higher number of active cases. This is just the numerator, not divided by population. But again, we see Cass and Burley-Morton again leading the state in terms of number of cases. As I've said before, if you're someone that lives in an outlying area that's a county that's got a few cases, but you plan on shopping or traveling or going to an event or going to an appointment in any of our large metro areas, you can see there that our 4 largest metro areas, Bismarck, Mandan, Minot, Grand Forks, and Cass County, also have the highest number of cases. And so if you're traveling to those areas and you're feeling at home that that there's very little COVID in your community or your county, that may be true, but if you're traveling to one of these areas, as you do, make sure when you go there that you're keeping physical distance, you're wearing a mask, you're washing your hands, you're doing all those things so that you're not someone either gets it yourself or carries it back to your community. When we take a look at the case rate, again, this is where we're dividing this by per 10,000 residents. You can see a little bit of a different picture here, that some of our lower population counties also have got some of the highest cases per resident. This is the same issue where North Dakota sometimes gets characterized as having high case rates per capita. In the same way here, some of these counties have got high cases per capita, but they've actually got very few cases. I do want to take a look at the relative to the region. We've got a slide here to take a look at again on the test positivity rate over the last 7 days. On the last 7 days, we shared the slide last week. We were at 10.8. Last week, we're at 11.1. So we're up slightly over a week ago. In the same time frame, a number of other states around us have seen, as part of this national surge in cases, we've seen dramatically rising positivity rates. And so, well, in North Dakota, we want our numbers to be going down, not not up, of course, but we're also, I want to say again, thank you to all the individuals in our state, everybody that is doing their job to help mitigate the spread, because the actions that are taking have allowed us to at least grow less quickly than some of the other states, as we say, from Wisconsin all the way to Idaho and others. So again, we want to keep fighting the fight. We'd like to figure out a way to weather this storm, and we can do that with everybody's help. One of the ways that we help provide guidance is through our risk levels, and we know that, as you recall, on October 14th, we updated the Smart Restart guidelines to better reflect and respond to sources of community spread, which is we lowered, with the October 14th updating, we lowered some of the gathering size requirements because we identified those as areas that were, potential spreading events. At that time, we also moved a number of counties into new risk levels across the state, and at that time, we moved 16 counties into the high risk or orange level. And over the past 2 weeks, we've been reviewing and monitoring the data, and today that we're going to be announcing some additional changes. When we've announced these in the past, we've had some counties that have been moving to lower levels of risk, today reflecting the widespread community community spread and the fact that we're seeing more cases across the state. We have no counties across the state that are going to lower levels, but we do have a number of counties, 21 in fact, that are moving up. We'll go from start from the lower levels of risk. We did have some counties that were, 5 counties that were in the blue, which was the new normal risk level. Cavalier, Griggs, Pierce, Ransom, and Steele, those are all moving up to the green or the low risk level. We have 8 counties that were at the low risk or green level that are moving into the moderate level, and that includes Adams, Hettinger, Kidder, Pembina, Rolette, Stutzman, Trail, and Wells County. And then we have 8 counties that are joining our high risk or orange level. They had all been at the yellow level, and those 8 counties are Grand Forks, Mercer, Lemoore, Ramsey, Richland, Towner, Walsh, and Ward. So now we have, there is also, in addition to the 21 I just covered, there were 32 counties that are remaining constant at their current levels, and so we'll then, and you can see the list here of the ones that are listed here are going through no change, and then we'll just jump ahead to the map. All of this will be posted on the health website and the ND response website, along with the detailed updated guidelines that go along with these risk levels. Next topic is a testing strategy update. As mentioned earlier, Dr. Birx was highly complimentary of the entire team. That includes the North Dakota National Guard, the North Dakota Department of Health, the state lab, and our private sector partners. Because of the suburb job, as she described it, doing the testing that we're doing, and particularly with the capacity we had to be able to test in long-term care in all residents and all workers every week since last spring. It's a unusually high level of testing compared to other states, and then also the surveillance testing that we've been able to do to help us identify and isolate the asymptomatic carriers. But again, we want to redouble our efforts in this area, and whether that's the asymptomatic young people getting together, but even not just them, but whether you're 40, 50, or 60-year-olds, if you've been active and around people, you're physically healthy, not wearing a mask, you also could be an asymptomatic spreader. One of the areas that we're taking a look at, I know there's a meeting that is happening right now while we're here talking about the universities to get even more testing more students more regularly within higher education, because this would be, whether it's at our community colleges or our universities, our 2 years and our 4 years around the state. This would give us visibility into 11 communities and into a population that we could identify and test regularly, that would help us really understand community spread and could help us identify perhaps thousands of asymptomatic positives that could, when out of circulation, really help us flatten the curve. Another tool that we have, all the testing we've done in North Dakota, not only we've done more testing per capita than any other state, and this is when we've done that, we've also been doing that without any pooling testing. That's where you take multiple samples and put it in one vial and run it through the machine. And we've done it all on PCR in lab. This is the highest, gold standard of testing. So we've done more testing at higher quality testing, two of those things, than any other state. Now we have the opportunity here with the new purchase by the federal government, and they'll be, between now and the end of the year, they'll be sending 220,000 Binax Now rapid tests to North Dakota. These are point-of-care antigen tests that can diagnose coronavirus infection in as little as 15 minutes. About 61,000 of those have arrived that are in the state's possession, and then there's another 61,000 that are arriving at our long-term care facilities. These do require still a lower nose swab and to do it, but it's the lower nose, but again results in 15 minutes. This helps us take some slack out of the system, because if you identify someone who's a positive right now, then they can begin taking action to not have transmissible moments with other people versus waiting 2 days or more to get your results back. This will help us, because those 2 days could be the time frame when they are most infectious of other people. So this is it's not just 2 days out of any days, it could be 2 very valuable days. So it's not just the speed of these tests by shortening that time frame is one powerful way for us to, like I said, take slack out of the system and help us get people out of circulation faster. And again, meeting with the North Dakota University System Task Force today. That's happening as we speak. We're also have plans have already underway. The UND Med School we've moved the Hologic Panther machine up there. They're going to be able to do testing and potentially do some pool testing, and then the lab at NDSU to come online and do pool testing as well. These are things that are going to allow us to test more students with the same capacity. We're also got a Thermo Fisher machine that's coming to the state that's going to be set up and validated soon, and that's going to be able to do 6,000 tests a day on one machine continuously operating, but with substantially less personnel to operate it. And by substantially, I mean substantially. I mean there's could be as few as 4 to 8 people to run that machine, where we now have hundreds of people working in our lab as part of the 3-shift strategy we've been doing since last spring. We're also ramping up contact tracing. Minot State, North Dakota State University, and University of North Dakota, they're all establishing resources, and their resources are going to be able to help do contact tracing for students across the entire NDUS system, and then that'll free up some capacity. And again, we're still doing contact tracing in healthcare and in K-12, and as we worked successfully through that backlog last week, then as when we build up our contact tracing, we can continue to do that more broadly. The next topic is about hospitality resource grants. Resiliency grants, thank you. As a lead into that, we want to remind people again, the budget section met yesterday. They approved the $221 million of the CARES Act funding. That brings to the full deployment, or the $1.25 million that was given to the state last year by the feds. Over half of that money, the CRF funds, went to supporting individuals or businesses because, again, as we're working on a balance here of containing and slowing the spread of the virus, but making sure that the economic livelihood of our businesses and our communities and our state continues to survive, we're finding strong success in that balance. We have the 4th lowest unemployment rate in the nation at 4.4%. That was in September, and that's even with the large oil field unemployment that we are seeing due to the demand shock that happened even pre-COVID. We know that unemployment is double digits in some of our oil field counties, so the fact that we're at 4.4 statewide would tell you that we have some parts of the state where the unemployment must be in the 2 to 3%, which would be among some of the lowest pockets in the country. And so, again, hundreds of millions of dollars going out for individuals and businesses. That's helped keep employment going and keep our unemployment low. That's reflected in the economy still moving forward. Our sales and income tax collections are over forecast, and our general fund revenues are $92 million ahead of forecast through September of this year. That's 15 months into a 24-month biennium. I would dare say that there are just about every state in the nation would take our unemployment rate and a head of revenue forecast. And again, this is a credit to all North Dakotans who found a way to keep their businesses going and innovating around business models and being innovative at a time to collectively keep our economy alive during a time. It also reflects the fact that last spring, when we had very few cases, in retrospect, that we did not we were not overly aggressive about shutting down and quickly reopened portions of our economy, and that's again helped us be in this strong financial position now. And when we're in a strong financial position, that gives us the ability again to fund the additional resources that we have, both to healthcare and to education. But one area we know that is still really hurting is the hospitality industry, and whether it's less travel because more corporate travel is way down because people are conducting businesses via electronic means. Conferences are way down, and so that's hurt the event space. We know that bars and restaurants and others have been affected by the pandemic. Lots of the PPP dollars, the $1.9 billion of the payroll protection plan from the federal program, went back to businesses that were asked to close during last spring's precautions, and so that helped again keep employment up. But as they've reopened, business has been challenged, and so we are repurposing some of the prior dollars, and the legislature yesterday approved more dollars, and so now we have a new grants specifically targeted. The economic resiliency grants are going to be helping those businesses and industries affected by COVID-19. There's now approximately $54 million available in this new program, starting right now, support food and drink, entertainment, hotels, production companies, all of those people would be eligible for this, and while they've faced sometimes dramatic declines in revenue, they're pillars in both our rural and urban communities across North Dakota, and they're vital for employment. They support tourism and they support quality of life for our residents. There are about 3,000 business establishments that cover these areas that have been identified in North Dakota, and the hospitality ERG will be used to reimburse their costs they can use it for operations, payroll, rent, utility, technology, and other expenses that comply with federal guidelines. These hospitality ERG grants are going to have a little more flexible approach to them than some of the grants that we're giving out earlier. The maximum grant per entity is $25,000 and $75,000 maximum for an entity that might have multiple locations. and any entity that receives grants for more than one location is eligible only for $25,000 per location. And once you receive these dollars, of course, then those businesses are required to comply with the North Dakota Smart Restart protocols per the county guidelines that are out in for wherever that business is located. Businesses that receive funding from the first ERG round, they are eligible to apply for a second round of expenses for expenses that were not previously covered. You may not submit receipts for the same receipts for both, but if you had some items that were not approved in the first round, they could be eligible expenses for the second. Again, more information about the hospitality ERG application process will be available at ndresponse.gov, but don't waste any time. These grant rounds are opening soon, and this money all needs to be distributed in compliance with the Federal CARES Act before December 30th. Secondarily, I also want to acknowledge again the legislature yesterday, the Emergency Commission a week ago, the legislative budget section yesterday approved the application deadline for the COVID-19 PACE Recovery 2 program, also known as the CPR 2 program. They've extended that to November 30th. They've added $20 million to assist businesses with interest payments accrued between April 1st and September 30th. This is funded by CARES Act dollars that were assigned to the Bank of North Dakota, and North Dakota business owners can work with your local lender to apply for funding up to $50,000 that covers the accrued interest payments. And again, this, even though it's Bank of North Dakota, I want to make sure everybody understands this is not a loan program. The Bank of North Dakota is administering a grant, and like the other PACE programs that we've had in our state for decades, the PACE program is an interest buy down, and so if you've got your proof of having paid interest between April 1st and September 30th for your business, you can apply. Hospitality businesses, you can apply for both the grant, the ERG grant, and for the BND interest buy down. So again, as we ask those hospitality businesses sometimes who are affected by the restrictions related to the restart guidelines as coronavirus cases go up and occupancy levels may go down, we're asking people to participate and help slow the spread, but we're also offering through these two programs support in the form of grants from the BND interest buy down and grants through Commerce for the economic resiliency grants. Next topic, child care survey. This is a call out to families that need child care. And so if you're one of those, listen closely. We know the child care providers have been a key partner in the fight to slow and stop the spread of the pandemic. They've been caring for the children of our essential workers and supporting our workforce, including healthcare workers, to be able to work. And thanks to the hard work of the Department of Human Services, the support of the Emergency Commission and the legislature, more than $40 million has been invested in the program, which was created specifically for North Dakota, called the Child Care Emergency Operating Grant Program. This was devised last spring, has been in operation since then, and money has been flowing out to help keep this important piece of infrastructure going, which is child care for our working parents. The grants have helped over 850 child care providers, both large and small, navigate the ups and downs of attendance and with the added health and safety practices and the staffing challenges they face. So again, our gratitude goes out to these 850 child care providers. Like all businesses, they've been navigating some uncharted waters. To go forward, to access quality child care, that remains an important part of our state infrastructure for our families, for our communities, our schools, and our workforce. And with that in mind, North Dakota Human Services, in partnership with Child Care Aware of North Dakota, is launching a child care survey to assess the impact that COVID-19 has had on access and use of child care since March, and to help better understand what working families may need going forward. The survey will provide valuable information to our lawmakers as they return and to agency officials going forward. It'll be shared with all the members of the Child Care Aware of North Dakota. And again, it'll help operators to understand needs, but all North Dakota families whose households include children ranging in age from newborn to age 12. So if you've got a newborn to age 12, and even if you aren't getting child care because you can't access it, we would encourage you to also take the survey. Families can complete this short 10-minute survey online at ndchildcare.org. If you're unable to complete the survey online, there's also an 800 number, 800-997-8515. Press 1 to speak to a child care data and referral specialist. We're giving this announcement today because the survey closes this Sunday, November 1st. So you've got a few days. Take some time tonight or this weekend to respond to that child care survey. Next topic is behavioral health. As we have since the very beginning included an update on behavioral health as part of these briefings because we know that in addition to the physical health associated with the potentially deadly disease of COVID-19, we know that everything related to the pandemic is also putting stresses on people's lives in ways that support their, or that can erode their mental and behavioral health. This was really highlighted. We had a fantastic fourth annual Recovery Reinvented yesterday. Over 2,700 people registered. At times during the day, there was over 3,000 different IP addresses all tuned in. All of the presentations from yesterday are going to be available at the recoveryreinvented.com website in about 2 weeks for replay, but a number of the key speakers, including national speakers, that talked and reflected on the important part of behavioral health during this time of COVID. But prevention related to behavioral health challenges, including drug use and overdose, and relies on the active involvement of multiple community partners working together to address these challenges. Drug-related claims, drug-related deaths claimed 79 lives in North Dakota in 2019, and that was more than the 76 deaths in 2017 and 66 deaths in 2018. We know that we have a pandemic going on related to COVID. There was another healthcare crisis, perhaps the largest in the country prior to the pandemic, was related to drug use and overdoses. Close to 80,000 people a year still dying in the United States due to drug and overdose related deaths, and of course that doesn't include all the deaths related to alcohol, which are a big contributor to the 40,000 plus deaths that happen every year on our highways. The Behavioral Health Division has been awarded funding from two federal grants. They've passed that on to 23 local public health units in the state to address substance abuse and opioid prevention, treatment, and recovery services. The department is going to be distributing $1.5 million over 2 years to 12 local public units to fund prevention programs targeted at underage drinking and an adult binge drinking. Thirdly, the Behavioral Health Division is providing funds ranging from $20,000 to $180,000 to 20 local public health units to address local needs and gaps specific to the opioid crisis. We've been hearing a lot about local public health, probably more than ever in your lifetime, related to COVID, but that's not their only job. Local public health has been in the battle fighting substance abuse. They've been working on drinking and binge drinking and underage drinking, and they've also been working on all kinds of other stuff. So we know they're stretched, but we thank them for their work, congratulate them on being awarded these grants. These awards provide opportunities to connect individuals to needed treatment services and to prevent overdoses and implement prevention strategies, including increasing access to the life-saving medication naloxone. As we move towards the end of the program here, we have our good news segment, and this sort of ties into deer season, which is coming upon us here shortly in November. But as many North Dakotans head into the field, or perhaps some that are the bow hunters maybe have already been climbing into their deer stands to take part of this time-honored tradition. There's one pastor in North Dakota that has found another use for a deer stand. Pastor Jonathan Starks of Calvary Church in Ryder, North Dakota, that's up in Ward County, has been holding drive-in church services began way back on Easter Sunday, created an opportunity for social distancing and protecting the congregation. But 28 weeks in total, he's been holding drive-in church services. Throughout the summer, he's addressed his congregation from a flatbed trailer as they arrived in cars, tractors, classic cars, motorcycles, four-wheelers, or more, to listen to the Sunday service on their radio. As the weather gets colder and Pastor Stark needs more additional elements, so instead of doing it from a flatbed, area resident Rod Johansson has offered his deer stand. So this Path Sunday could be a first in our nation. Pastor Starks led his first service from the deer stand. He was, of course, we had unseasonably cold weather. He was armed with only an electric heater and had about 70 people. But again, thank you, Pastor Starks. There are many ways that North Dakotans have adapted through the pandemic, but we want to applaud Pastor Starks and his whole family, who also participate in the services, in the congregation of Calvary Church in Ryder, who've embraced this new and interesting and fun drive-in services as a way to protect their community, but to stay connected as a congregation. Thank you, Pastor Starks. Other piece of good news coming up on November 2nd, North Dakota will celebrate its birthday, 131 years young on November 2nd. And of course, that marks the 131st anniversary of President Benjamin Harrison signing the Proclamation of Admission. That day, also same day for South Dakota. As we move to the next topic, Halloween, we know that we've seen more masks than we normally do in a year, and we're sure that there's going to be a lot of creative ones that will be coming out on Halloween. So we encourage everyone to be extra safe and while enjoying Halloween. And so again, masking and physical distancing and hand hygiene, all these things, if people are going to participate in this, but there's ways to do this safely, but again, always to make sure we're protecting our children on Halloween night. Each year, one of the really fun days of the year and one of the fun parts of being governor and first lady, the first lady and I have always looked forward to welcoming trick-or-treaters at the governor's residence. It has always led to large crowds. I think last year, in conjunction with our group from the North Dakota Geology Department, where we had a lot of real dinosaur bones and real dinosaur teeth and a lot of blow-up dinosaurs. We had over 900 kids that came through the residence last year. Because of COVID, we will not be doing in-person trick-or-treating this year. Certainly a disappointment for us, and I'm sure for the kids. But again, in accordance with the Department of Health and other guidelines, we want to be creative. We're hosting a virtual costume contest to give North Dakota kids a way to help celebrate Halloween. The site went up earlier this week, and there's information right here on Facebook, and we've got some people have already posted, but we're excited to see some creative and both the most creative and most North Dakota costumes. And you don't just have to be from the Bismarck-Mandan area, because trick-or-treating at the residence was probably really more of a metro area experience. But now wherever you are in the state, if you got your costume on, tag us on social media. We'll share some of our favorites after the holiday. But again, if you are planning on participating, there are guidelines at the northdakotahealth.gov for tips on safe ways to celebrate the holiday with your kids. And of course, whatever you choose to do, make sure you're doing it with physical distancing and hand hygiene and masking. We do not want the beloved holiday of Halloween to become any kind of super spreader event. And I would also, again, know that this is Halloween on a Saturday night, maybe reduces the number of party nights at our adult establishments. But if you're planning on heading out there, again, you be smart about masking or be smart about not going at all if you yourself want to protect. If you've got loved ones or others, you can, again, part of your individual responsibility, make a choice this year to celebrate perhaps differently, because we'll have Halloweens in the future without pandemics, but we're in the middle of one right now, and everybody's participation matters. In terms of gratitude, we have a comment and a quote. Yesterday, October 28th, was First Responder Appreciation Day in North Dakota. We've done a proclamation on that, and of course, we've acknowledged them many times throughout this thing. We wanted to take a moment to, again, thank the many first responders that are serving our citizens on the front lines. They've done it on everywhere from collecting tests to taking care of the regular emergencies that they do that did not go away with the pandemic. But again, we want to thank all of them. And for our gratitude quote for the day, 94-year-old David Stendal Rast said that in each of us there's a spark that can reverse trends of violence and depression spiraling within us and in the world around us. By setting in motion the spiral of gratefulness, we begin the journey towards peace and joy. And again, certainly gratitude can create positive spirals. And so again, as we share our gratitude to each and every one of you for doing your part to help slow the spread, if you can pass that on to others that you see, share your gratitude with them, that can help create a form of positive reinforcement that will help us navigate the certain challenges that we have in front of us. With that, we'll take time to stand for a few questions. Okay, I'm going to go to Jacob first.
Governor, when Dr. Birx was in town, she mentioned how a number of cities and states that don't have a statewide mandate, the larger cities have created a matrix of mandates that essentially equate to a statewide one. That being said, many of the cities in the state that do have some form of mask requirement, there's no penalty, there's really no teeth to these requirements. So my question is, what kind of effectiveness do you think these local decisions have that you've been pushing for?
Well, I think that from the mayor's call, I would refer you to that, Jacob, is that we're seeing some positive signs. And, this is about social psychology as much as it is about law. And I believe that the strongest motivation is when people find their own reason for participating, that they have a personal reason to want to participate in helping to slow the spread. That's why we talk about finding your why. It turns out that some people, for whatever reason or another, some businesses, some individuals might have said, yeah, hey, I'll wear a mask, apparently, if everybody else is going to wear a mask. And so maybe it's like a group psychology thing, because we have had a couple mayors that said, yeah, we put in the mandates. No, they don't have any teeth. Have we seen increased participation? Yeah, we have. If that works in their communities, I mean, like, hallelujah, that's the case that it does. But I think the business communities, I think there's the psychology of competition where people have said, gee, if I ask my customers to wear a mask, and we think in North Dakota that people don't want to wear masks, if I ask them to wear a mask, they're going to go to my competitor. Well, now if the chamber says, hey, everybody step up and everybody put in masks, well, that levels the playing field, so it takes away that fear of lost revenue or fear of that. So when some people are, happy to defer the decision to another level. In this case, if a mayor or city council or a business group stands up and says, let's do it, maybe that's all it takes to get people that were there. But we also had people that said, hey, you can't really say it's the mandate that's getting people to wear masks more. It could be the fact that people are starting to take this seriously. I mean, when you start seeing 1,000+ cases a day, we had a couple mayors that said, yeah, it has nothing to do with government or enforceability. It's like people are just waking up to the idea that you could get this thing and it's bad, and maybe it's a good idea to mask up. So the probability of mitigation being accepted now is likely higher than it was at any other time, because the case counts are higher, and more people are unfortunately likely have known someone who's been seriously ill or passed away. And sometimes people don't take anything seriously until they realize, hey, it could happen to me or my family. That's just human nature. It's, hey, it was in Italy. Hey, it was in China. Hey, it was in New York. I mean, hey, it's not happening in North Dakota. But now you'd be like, hey, it's happening in our region. It's happening in North Dakota. It's happening places. Maybe we should take this thing seriously. So that's where I would say. I'm going to flip over here to go online.
James McPherson with the AP. Sanford Bismarck President Michael LeBeau told a cable TV network that he thinks, quote, "We have turned the corner in our state. All of our major cities have mask mandates in place," end quote. Do you believe that we have turned the corner in a positive sense?
Well, I said one of the things that would be positive is all relative. I mean, when we see the numbers, the positivity rates really going up in the region, and ours, week over week, 10.8 to 11.1, I wouldn't call that turning the corner. But particularly when we've had today, we have had our second highest positivity rate on a really large testing day. There are signs of optimism, but I'm not going to say we've turned a corner yet, because I think we need to have more. We need to see that the participation, the people finding their why, that people joining in for whatever reason to start slowing the spread, the percentage of people doing that goes up, and we've got to make sure that we've got really high compliance on people that are positive, making sure that they're isolating, and I'll be more confident when we've got our even more strategic testing strategy going, where if we could be pulling out thousands of more asymptomatic spreaders every week, then that I think would also be something that would give us another piece of hope that we're going to turn the corner. But right now, with the level of cases that we're seeing right now, I think this is not a time for us to. This is not a time for us to do anything but to get more serious about getting more people on board with appropriate mitigation strategies. And remind me, is it Maddie? I was going to say Maddie. I should have said it, but anyway, Maddie, good to have you back. Thank you.
So a recent study from University of Kansas looked at 20 out of the 105 counties there that have enforceable mask mandates, and over the course of a few months it found that those counties with the mandates that were enforced had half as many cases as the statewide average. So you mentioned that if you saw research showing that mask mandates work, it could be a consideration. So what do you think about that study? Well,
I've looked at studies like these, Maddie, and I've looked at ones at the state level too. You have to take a look at the makeup of those counties, because if the makeup of the counties were predominantly folks that supported mask mandates before they put the mask mandate in, because it turns out, elected officials are the ones putting in the mask mandates. Mask mandates went in more quickly in places where people supported wearing masks. So this is where I've said we've always supported mask wearing as a way to slow the spread. If you're trying to put a mask mandate in where most people don't support mask mandates, it could have the opposite effect. So I think you've got to, in the world of statistics, you'd have to take that data and then take a look at the populations of where those represented and who's in those and what was their propensity to already be wearing a mask before they put in the mask mandate. Because if they've slowed the spread, it's because of mask usage, not because of the mask mandate. And like I said, mask mandates went in quicker where mask usage was higher. So you could find correlation in those kinds of studies, but not causality. And so I think masks lower the spread. I think mask mandates can be at times correlated to that, what you're showing, but it may not have been the cause of the slowing of the spread. It's the actual usage of the mask. Because you've got places where you've got mask mandates, like say Wisconsin, where they're having record cases and record deaths and record hospitalizations. And so then would you say masks don't work? I would never say that, because they're people that are wearing them in Wisconsin they're part of the solution. But so it's the causality versus correlation. But I dove into statistics there. Sorry, Matt, fire away.
Kind of to follow up on that, you've said several times that mandates may decrease participation. What studies are you referring to support that claim?
Well, I think that you don't have to go any farther than our own state or other places where you have seen that and again, here we are again talking, we're not talking about the pandemic, we're not talking about how to slow the spread, we're talking about whether you have a mandate or not. We're not talking about if we want to talk about the effectiveness of masks, we should talk about that, because we've been saying that since day one. But if you have a 6-hour city commission meeting in a community because people are adamantly opposed to wearing masks, this is where, again, you can have people reacting to the mandate, and then they may not wear a mask as part of, I'm protesting being told to wear one. That's, again, psychology or a belief system versus where we're really trying to do is get people to figure out how as humanity we're all connected to each other. This virus moves from human to human. One of the ways you can stop it moving from human to human is not letting the stuff coming out of your mouth go to everybody else. And so we want to try to keep the focus on the effectiveness of masks, and we're trying to stay out of the effectiveness of mask mandate pieces. But we support all forms of them, whether there's incentives. And we talked earlier, I mean, the Mayor Johnson from Devil's Lake, they've got a thing up there called Chamber Bucks. Some of their businesses are offering customers $5 in their little chamber money to people as a way to say, hey, thank you for wearing a mask. I mean, there's sticks, there's carrots, there's community support. There's all kinds of ways. We would like to see higher mask usage in North Dakota as we head into this dangerous stretch of Halloween plus deer hunting plus Thanksgiving plus Christmas plus cold weather plus indoors plus low humidity plus regional storm plus global spread plus third wave. This would be a good time for people to, get on Team Mask Up.
Have you heard of any stories, though, where mask usage decreased because of a mandate? Are there any specific examples?
I'll let you, if you guys want to keep battling mask mandates, I mean, it seems to be quite an obsession of the media. I'll let you guys deal with that. We're going to try to get the numbers down in North Dakota. So we'll keep doing that. Jack?
I'd like to ask about masks at the Capitol, Governor. The legislative leaders have endorsed a mandate for the legislature, and I'm curious how Bismarck's mandate might affect use at the Capitol, since every person within the city of Bismarck shall wear a face covering in all indoor settings open to the public where a person is exposed to non-household members and where social distancing of 6 feet or more cannot be assured. Would you plan to issue a mandate for the Capitol building?
No mandate's going to be required because what their team is, the continuity of government team, I believe, put out support for this yesterday, and they also did it statewide because we've got state employees in Fargo and we've got state employees in cities all over the state. We basically said, hey, we support people participating and supporting the local, whatever the local guidelines are. Then state employees, as citizens of those cities, should be following that. If you really want to get into the fun weeds of the thing, then when the Capitol was first built here, and even pre this building in the 1930s, this was outside of Bismarck. The actual land here is not part of the city of Bismarck. It has its own zip code. And so the police force would not have first jurisdiction here. The highway patrol would. This would be I don't want to call it like a DC type thing, but having all that, if you want to go into the deep weeds, if someone is really into it, maybe Dave has researched this years ago, but it's there is a kind of a different set of relationship between the Capitol grounds per se, not other state buildings in Bismarck, but the Capitol grounds in the city of Bismarck. But having said that, that's all like in the weeds. Here in the Capitol, as part of the continuity of government, we're supporting the Bismarck rules here on the Capitol grounds as well.
What did Dr. Birx tell you directly about a mask mandate?
We talked about lots of different things, but she did not tell me anything directly about mask mandates. I mean, what I heard her say was, you heard what she said in the press conference, and she again supports, and then she came back. I mean, she took issue with how her meeting was reported. She got involved in North Dakota media following that, and made her very clear in that. So I think there's both what she said when she was here and what she said after she'd leave. I think her record can stand for herself on what she said on that. I've got I'm going to go Adam, and then I haven't done online yet. I did one. Okay, I'm going to do Adam and one online, and then we're going to wrap up here before 5. Adam?
One more question on the mandates. You've previously raised some skepticism about whether, or been hesitant to enforce them because, been hesitant to apply them because you said you didn't think they'd be enforceable. Do you think these local governments have put down rules that won't be enforceable?
I think, again, it's we're in the weeds of enforceability. I think what matters to the state of North Dakota, if our businesses are going to be open, if we're going to have kids playing in gyms full of spectators with, they might be wearing masks, but if we're going to have basketball games this winter and not canceling, if this thing keeps going at the rates it's going around the country, you're going to see all kinds of things. You could see a return to businesses being shut down. I know that in some other cities, I think in Chicago today, they announced that they're suspending indoor dining, which I think means you're suspending dining in Chicago. They got weather that's pretty similar to ours as we head into winter. You're going to have that. We in North Dakota have a choice. We have a chance to keep our kids in school, our businesses open, our economy going. We have a chance to do all that, but it requires everybody to figure out a way to keep physical distance, and if you can't, then to wear a mask. And if we can do those things, avoid large gatherings, use hand hygiene, we have a chance to, we can shape our own destiny. We can do that. That's what we have in front of us. And like I said, doesn't require government mandates, doesn't require any of that to do that. It's just people making the choice. And I still believe, I've said it before, I think there's something way more powerful than government, and that is an individual's love for their family, a love for their community, a love for their team. These things are powerful motivating forces, and we know that in the land of liberty that this country is and this state is, that some people actively resist when government tries to do something, and I completely understand that. And so if we want to be the land of the free and the home of the brave, if we want to be the land of the free, then let's make sure that we're using that freedom not just for our own individual liberty, but also for protecting the health of others, because it's not a cliche to say we're in this together when we have a virus that can only transmit human to human. We have it in our power to stop that. So, I am thrilled to see local leaders at all levels, whether it's business leaders, mayors, county commissioners, faith-based leaders, civic leaders, healthcare leaders, everybody doing what they think they need to do locally to help get increased participation in mitigation, because that's the goal here. The goal is not about, it's not the person with the most number of mandates wins. It's the people that have the fewest number of cases is the one that wins. And the way we have the fewest cases is we have the highest amount of participation. And maybe think back to your own life. When did you really enjoy participating? When you were being told you had to do it, or when you really wanted to do it? And I think we know the answer to that. It's as old as human history is, and it doesn't matter whether it's piano lessons or pick the thing that you didn't want to do when you were a kid and were being told to do it, that maybe you wished later you did, but pick that thing. And it's like, again, it's motivation is strongest when it comes from within. And so let's just understand that. And as a state, we're small enough that we got enough local leaders here, local leaders leading the charge, setting the pace, being role models, parents. Doesn't have to be elected leaders. Parents can be. I've talked to parents that say, I've got to talk to parents that said, hey, my 14-year-old is coming home and saying, hey, Dad, you can't go out of the house without a mask. We got 14-year-olds that are leading. The kids are saying, we got to wear them at school. We're not going shopping without that. So, leadership comes at all levels. And we've got some youth in the state that maybe are going to show us the way too, because they'd like to stay in school. They'd like to play basketball. They're motivated. They're not showing up at these, it's the adults that are arguing over the mandates. The kids want to have their lives. So let's fight and do it for them. I see you got your hand up, Matt, but I'm going to do one online, and then that's my last one.
Can I do a non-mandate question after that?
Okay, that's allowed. That is allowed, plus you're wearing your Eagles mask, and I made it through last Friday without talking about that incredible fourth quarter pass by Carson, which I had taped the game and made sure that I was online for the first time in 7 months, and I made it to be able to watch the game that night, and so it was pretty fun for me to see that turn out, because I wasn't sure it was going to happen that way. But you're after the online question, Danny.
Does the fact that no one seems happy with the balanced approach you've taken give you confidence that crafting a strategy to protect both lives and livelihoods was the right approach?
Well, for Scott's question, I didn't have any expectation that in taking this job or being thrust into a position of leadership during a pandemic that my job was to make everybody happy. And I think if we've got people on both sides of every argument that are not happy with us, and we do have this balanced approach. If you're trying to drive down the middle and solve a problem that's a data-driven, common sense, pragmatic approach, which we've taken, you're going to run into emotion and ideology at both ends of that spectrum that are not going to be happy at what you're doing, and it's a tougher path to try to stay down the middle because you have to take criticism from all sides. But I'm confident that the balanced approach in the end is going to help us do it, because the balanced approach, I mean, we're managing mental health, behavioral health, education, the economy, and we're doing all that, and we're trying to slow the spread of a very particular disease. So there's dozens of things we're managing, and the balanced approach is the only way that I would see possible doing it, because there may be some people that have choked down the spread of the pandemic, but in the process, if they've killed their economy and increased drug use, suicide, kept kids out of school, the effects of that are going to be seen for generations. They might be waving a victory flag right now because they think they've beat the pandemic, but they will have created generational problems that are going to follow them. And I think in North Dakota, in the long run, you're going to see that the balanced approach was the right solution for our children and for our economy and for our society. I truly believe that. Okay, Matt, last question. The final question of the day is not even in it. No. Not about mandates.
It's not about mandates either. I've noticed interim state health officer Dirk Wilkie has not been out here by your side. Some have pointed out or wondered, is that giving the perception that the administration is battling the virus from a business perspective rather than a medical one? And I looked into his background. He never even studied medicine. He studied business, law, and communications. Is he the right guy to help lead us through this pandemic, and why hasn't he been out here to answer questions?
Well, Dirk's been a key part of this and been a sort of a steady person at the helm as effectively the chief operating officer of the Department of Health, and we always had this division, and I think it's going to be discussed again. By the legislature, is how do we set ourselves up? How do we create a role where you can recruit and retain people and set them up for success who've got the medical expertise? Because if you have someone with the medical expertise, they often don't have the operational expertise, which you described. And right now, the logistics around taking a lab from under 200 tests a day to over 6,000 tests a day, going from 10 contact tracers to 450 contact tracers, the number of IT issues, because there's an IT issue and everything, the level of business, IT, logistics, planning, scaling, hiring, interviewing, that no other agency has ever had to scale. No other agency probably in the history of the state in 131 years has had to scale like this one. So everything they're doing, plus with our chief operating officer, Tammy Miller, plus with General Dorman, I mean, we have had thrown a ton of leadership around the health department. Given that Dirk does not have a medical degree, whenever we have someone in that position as interim, then we reinstitute our health advisory group, and we have been having regular calls. Tammy Miller, I don't know if it's every day or multiple times a week, but Dr. Wynn, who's leading the strategy for the state, Dr. Carson at NDSU, and then a bunch of other people that we have, epidemiologists, Kirby Kruger and others that work in the health department are all part of the strategies all the time. And I've been on Zoom calls with all these folks, or not Zoom, I guess it's Microsoft Teams calls here, but we are there. We've got plenty of involvement from healthcare professionals throughout this. But again, it's a holistic approach. both the green team, which has been reestablished in the last month, also includes medical professionals from local public health, and then the Unified Command has also got input. So we're getting input from the healthcare community every day from multiple sources, in addition to everything we're getting from all of our calls with long-term care that Chris Jones has all the time, and all of the stuff we're doing with the hospital leaders. So we're a healthcare community, both individually, collectively, deeply involved in all these strategies.
Have someone with a health background, especially during a pandemic, leading the way, wouldn't that be a good qualification for that position?
Absolutely it is, and by law, the state health officer has to have medical qualifications, and finding someone with the medical qualifications who's willing to take a giant pay cut and assume enormous liability for decisions they make, turns out that's a hard position to fill. And we've had 3 very good health officers this year, and as I have said before, I would have offered to write references for all 3 of them. Anything that says that that there was a conflict between me and any of them personally, that's just not true. And but it's just a super difficult position to fill, and super difficult position to execute against. But what's that?
Have you had any applications for?
We have had applications, and the position is open, and we'll continue our search to find someone. But I think there's also going to be there may need a legislative solution in here that could be related to pay, could be related to liability protection, could be related to structuring, and to make sure we got both a health officer and a business operating officer. But nothing in code anticipated that an agency was going to have to scale the way this one has had to. Like, again, not just a little bit. I mean, we're talking 20 to 30 times. You're not even halfway through a biennium, and you're doing 20 to 30 times more activity across key functions in epidemiology, in the lab, and in the medical cache, and all the other things than you thought you were. I mean, this was out of the range of any plan that I'm sure any health department had in the country.
Does the job pay? I realize it could vary.
I think that's your 4th question on this follow-up thing, but thank you for not having any of them be mandate related. Okay, take care, everybody, and happy Halloween.